गुड इवनिंग एवरीवन। जेएनयू की पाठशाला यूट्यूब चैनल में आप सभी का फिर से हार्दिक स्वागत करता हूं मैं। आज हम पैथोलॉजी ऑफ द डिजीज ऑफ द लेबोरेटरी एंड द वाइल्ड एनिमल डिजीज जो यूनिट 6 के अंदर वेटनरी पैथोलॉजी का है उसमें कवर होता है और वो पेपर 2 के अंदर कंसिडर होता है, उसके बारे में हम आज चर्चा करेंगे। जैसे कि हर बार हम जो पार्ट 1 ऑब्जेक्टिव और पार्ट 2 सब्जेक्टिव जो पैटर्न है एग्जाम की उसके हिसाब से हम देखते हैं, और आगे के जो यूनिट 1, 2, 3, 4, 5 के वीडियो जिस किसी ने नहीं देखा है, अगर आप देखना चाहते हो तो उसकी लिंक मैंने डिस्क्रिप्शन बॉक्स में डाल दी है, वहाँ से आप उसको एक्सेस कर सकते हैं। सबसे पहले ऑब्जेक्टिव पार्ट में गिव द स्पेसिफिक वर्ड और द टर्मिनोलॉजी फॉर द फॉलोइंग। फर्स्ट है फेलाइन पान ल्यूकोपेनिया इज ऑल्सो नॉन एज। फेलाइन पाइन ल्यूकोपेनिया को हम दूसरे नाम फेलाइन डिस्टेंबर से भी जानते हैं, फेलाइन एंट्राइटिस से भी जानते हैं और एक ग्रेनुलोसाइटोसिस से भी जानते हैं। जनरली ये इंपॉर्टेंट डिजीज है वाइल्ड फेलिड्स के एमोंग। सेकंड है एबिचूटिक डायरिया ऑफ द इन्फेंट माइस, इट इज कॉज्ड बाय द रोटा वायरस। Third है Sendai virus, one of the most important pathogen of the mice and the rat is a single-stranded RNA virus of the family. Which family का वो particular virus है? That is from the Paramyxoviridae family. Fourth question है mouse hepatitis virus is a single-stranded RNA virus of the which family? And it is I think it is from the Coronaviridae family. Fifth one है causative agent of the mouse pox, that is the ectromelia virus, ECTROMELIA virus. Sixth, Thieler's murine encephalomyelitis in mice is caused by picorna virus. Afterward, from one word, we will see toward the particular the fill in the blank of the following. First one, scurvy is commonly seen in which animal? Laboratory animal. That is due to the in particular vitamin C deficiency, and it is observed in particular guinea pig. Second one, Kaisanur forest disease is caused by fill in the blank and the transmitted by the fill in the blanks. Actually, it is caused by the flavivirus and it is transmitted by the ticks. Third one, Rift Valley fever is caused by fill in the blank and transmitted by the fill in the blank. Particularly Rift Valley fever, it is caused by the flavivirus and it is generally transmitted by the mosquitoes. Fourth one, hepatic coccidiosis in rabbit is caused by Eimeria stadi. Now we will see some of the important true and false. You have to state whether a particular statement is true or false. First one, mice is the most susceptible to both ketosis and the true pregnancy toxemia. That is false. Actually, mice it is not susceptible, but guinea pig it is the most susceptible. Second one, the West Nile fever is caused by the flavivirus. No, actually West Nile fever it is actually false. Actually West Nile fever it is caused by the flavivirus, but flavivirus is responsible for the Rift Valley disease. Third one, the trypanomatosis is also known as ventral spirocatosis or the vent disease or the rabbit syphilis. Yeah, it is true. Fourth one, the California and the standard laboratory strain is one of the most important for the infectious myxomatosis. Means it is strain of the infectious myxomatosis. Yeah, it is true. Fifth one, the vertical transmission is observed in the lymphocytic choriomeningitis and the mouse hepatic virus. Yeah, it is true. Means in these two diseases vertical transmission happen. Vertical means particular transovarian or the transuterine transmission. Now we will see toward some of the MCQ means objective portion in which you have to tick the most appropriate answer. First one, the feline pine leukopenia is the highly contagious and the usually fatal febrile disease of the which animal? Cat, tiger, leopard. It is all of above. Second one, the feline panleukopenia is caused by parvovirus. Feline panleukopenia virus is closely related with the canine parvovirus too. Canine distemper is seen in tiger, bear and the raccoon. It is observed in all of above. Chattering in mice is seen because of which infection? That is caused by the Mycoplasma pulmonis. उसके बाद है म्यूरिन रेस्पिरेटरी माइकोप्लाज्मोसिस MRM, इट इज कोज्ड बाय which of the following etiology? That is the Mycoplasma pulmonis. Now again we will see some of the important objective only in continuous. Oral papillomatosis are caused by the papilloma virus. Mosaic spleen in mouse is seen in mouse pox. Angiotic pneumonia in laboratory animal is caused by the Pasteurella pneumotropica. The experimental animal used for the FMD research, that is the guinea pig. A transmissible murine colonic hyperplasia, it is caused by the Citrobacter rodentium. Predominant causative agent of the rabbit enterotoxemia is Clostridium sporiform. A rabbit hemorrhagic disease virus is a single-stranded RNA virus of the wish family that is caused by the calciviridi. A reservoir host for the Ebola hemorrhagic disease, that is the bat, answer is D. Tiger's disease is caused by the Clostridium piliformis. Dwarf tapeworm of the rat, it is Hymenolapis diminuta. Last mega ileitis as an important postmortem lesion observed in which disease, that is in Tiger's disease. Guinea pig required at least 5 mg of the ascorbic acid per day for the normal growth and the reproduction because they lack the L-gluconolactone oxidase. That's why scurvy is most important in particular guinea pig due to the deficiency of the enzyme L-gluconolactone oxidase. Afterward, the West Nile fever is transmitted by the which type of the mosquito, that is by Culex species, whereas the Rift Valley fever is also by the transmission by the mosquito, but it is caused by the Aedes species transmission. Kaisanur forest disease is disease of the rodent, monkey and the screw, all of the above. West Nile fever is transmitted by the mosquito. Ebola hemorrhagic disease is caused by the filovirus, answer is C. Monkeypox is caused by the orthopox virus. Now we will see the match the column with A with B. First one, tularemia, means it is caused by the Francella tularensis. Last one. Second one, fat rat syndrome, it is generally observed in Tiger's disease. Snuffle in rabbit, it is caused by the Pasteurella multocida. Rabbit syphilis, it is answer is Trypanoma paraluis caniculi. Ringtail, it is not tall, actually ringtail in rat, it is occurred due to the low humidity. Renal coccidiosis in mice, that is etiology is Closelia muris. Pseudocroidinitis virus, that is particular arena viridi. Ear mite, that is Soroptic cuniculi, and the fur mite, उसको हम walking dendrop भी बोलते हैं, that is the Chelitelia parasitiorax. And the last one, lymphocytic choriomeningitis virus, that is the particular in corona viridi. Now to define the following four definitions which are the most important in particular from the unit 6. First one, fat rat syndrome, it is observed in particular Tiger's disease. Second, blue breast, it is generally it is one type of the inflammation of the mammary gland, usko mastitis bhi bolte hain laboratory animal mein. It is caused by the staphylococcus species. And the ventral spirochetosis, that is the one type of the rabbit syphilis in particular rabbit. And fourth one, hepatic coccidiosis, it is a particular produced in granulomatous type of the lesion in the liver, and it is caused by the Eimeria stadis. Now after the part 1, now we will see to part 2 subjective portion. First one, long question, and only one long question which are the important. Analyze the various laboratory animal disease in which you have to mention the certain disease like the bacterial and the viral and any other disease which you want to remember that particular disease. And describe in the brief about the pasteurellosis in rabbit. In pasteurellosis, you have to write all the form of the particular, whatever the form. It is producing the various type of the form, and you have to note down and write down this 5 or 6, 5 form is there totally, and you have to write that 5 form due to the Pasteurella organism. Afterward, the long question. Now we'll see toward the short note. Only 4 short note which are the important. First, the Tiger's disease. Second one is the hepatic coccidiosis. Third one is West Nile fever, and fourth one is Kaisanur forest disease. And last one, the differentiate the following. Only one difference which are the most important, that is the Tiger's disease versus the enterotoxemia. This all about the unit 6 and actually particular laboratory animal and the wild animal disease. And apart from that particular many of the disease which are the important in wild animal like the theileriosis, rabies and that all, but this all the disease which are the important in wild animal, but it is already we have covered in that particular unit 4 in particular infectious and the non-infectious disease of the domestic animal. Means rabies in dog, it is also same type of the particular pathology and the pathogenesis, and it is same into the wild animal. So I have not repeated that particular question which already I have covered in unit 4. Thank you for the watching. I request you to like, share and the subscribe. Thank you. We'll meet again. Thank you.